I'm Dr. Fred Hong. I'm a hematologist oncologist with the Roswell Park Care Network in the Northtowns. I went to medical school at the University of Vermont, um, and then I was in the New York State program, so I came to Buffalo to do my training. And at that time, I knew I was interested in doing hematology. We take care of patients when they're very sick. And not that other physicians don't as well, but they're facing a crisis, and you don't just take care of the patient, but you actually take care of the family. And so that's what appealed to me, that I was involved. I was very interested in critical care medicine, and it almost is critical care, except every day or every week. And you really become very close to the families, and families, they take you as one of their own. If you're, they call you up. I talk to them on weekends. You really bond obviously well with your patients, and I think they appreciate that. When they asked me to become part of the care network, it was actually almost just a formalization of what actually was already in practice. In that, I think what's nice is that we're kind of a nice, pleasant introduction, if you would, and then downtown we have the subspecialists that are true experts in each of these fields. And I can draw upon their knowledge to take care of the patients. So frequently I have patients that come down, they meet with them, and then they get their care. Maybe it's a little easier to come to our office. Sometimes, particularly if you're an older patient, your children may be helping to bring you to the office visits. And so it's maybe a little quicker. Sometimes we can get some of the treatments. Certainly some of the very high-tech stuff should be done downtown, no question. You need to have that whole core of people in the hospital behind it to be able to give the necessary care that you need to do that. Patients are really the biggest motivator, right? They give us the privilege of taking care of them. And they really trust us. I mean, if you think about it, that's the most important thing, and their families as well. So what motivates me is it's just been amazing to see the progress that Roswell has made, as well as certainly all the cancer centers across the country. Being part of the Roswell Park Care Network is critical for my patients because it encompasses not only the diagnosis, but then the latest treatments, also the innovative therapies that are being developed, and then also the aftercare. And it's patients that do well as patients that don't do well, because we deal with a lot of the different issues that come on. And these issues can go on for years. I have a wonderful wife, and we do a lot of stuff together. So she actually got me into, believe it or not, golf. So I do that. So she knows I'm there if she can't find me. And then actually I love medicine. I enjoy medicine, and then I do different sports and things. But